My name is Maricela Garcia. I'm the Race Equity Director for Arkansas Advocates for Children and Families. I'm so glad that Dr. Guinevere White is here with me today to talk with all of y'all about WIC and nutrition and health during pregnancy and in the first years of children's lives and the importance of it. First, though, we are going to hear from the director of the Arkansas WIC program. Fortunately, she couldn't be here with us tonight, but she was able to record a video to welcome all of you and talk about how the state sees the WIC program.
Hello everyone, my name is Mitzi Fritchen and I am your state director for the Arkansas Department of Health WIC program. And one of my favorite things to do is to tell other people about our program, what we do, how it can benefit you. I have worked with the Arkansas WIC program over 31 years at this point. I love the WIC program. Obviously, if I stayed 31 years, I believe in our program and what it can do to help Arkansas families live and reach a healthier place in life. So I'm honored today to be here to share a little bit of time with you, just to welcome you robustly on the behalf of the WIC State Office. I want to thank our partners, the Arkansas Advocates for Children and Family, for being such a great partner to us and wanting to help us help you learn more about the Arkansas WIC program. And just to encourage you, if you're eligible, or if you even think you're eligible, to check into our program. I think that we have a lot to offer you, and we sincerely do care about each of you, your families, your children, and it's definitely a goal of ours to do everything we can to assist you in becoming healthy families and healthy Arkansans. The first thing you might ask yourself is, I've heard of WIC, but really what is WIC? Okay, I can answer that. WIC is actually the supplemental nutrition program for women, infants, and children. So that tells you we're all about helping new moms, women who are pregnant. Our eligibility period goes until a child reaches their 5th birthday. The WIC program has been around a long time. Will actually be 50 years in 2024. The WIC program is a little bit different than some of the other food programs that are out there in our state. We, of course, provide supplemental foods. What varies from other programs is with WIC, we provide a food package, a food prescription that's very specific to the pregnant woman or the child or the infant. So it's tailored to meet just what your needs are. And the foods within different categories are designed to help you and your family meet the important nutrients that are needed. So we provide supplemental foods that hopefully help fill in the gaps of maybe some other services or some other resources that you receive food assistance from in your community. You will be issued your supplemental food benefits on a little card about that large. It looks just like a credit card, but your WIC information is embedded in a little chip. So when you go to the store, it's like using your credit card. And also we have an additional benefit for fresh fruits and vegetables. Now, WIC is also a little bit different in that we do not ask or collect Social Security information. We don't need that to serve our participants. We do not ask about citizenship status. We do not require a visa. So definitely don't want that to hinder anyone from accessing our services. If you consider that Arkansas is going to be your temporary or your permanent home, We welcome you to apply. All we need to know is that you consider yourself to live in Arkansas. The second thing would be that you can give us some type of proof of identity. It doesn't have to be something with a picture on it. Something that has your name printed on it would work just fine. In addition to that, we've got to assess whether you're income eligible to receive the services. If you receive a service like Medicaid or SNAP, you're automatically eligible for WIC. So if you fall outside of that parameter and you need to actually show proof of income, we just need to know what's available to the family for the past 30 days. If you're on the border, we can actually count an unborn child because the income guidelines depend on household size as well as income. The other thing that you may not know is that we do have translation services that are available in our health unit. We have an actual service that we can call and access, I believe, around 60 different languages. We have some staff members statewide that speak Spanish and also speak Marshallese. So we also have materials that are available. So this particular one is our shopping guide, and it tells about your WIC-approved foods in all the different categories. And if you open it up, the food categories are divided into protein foods, cereals, juices, all the different other food categories as well. So we have this translated in 10 languages at this point. But the 3 languages that we normally get requests for in Arkansas are, of course, English, Spanish, and Marshallese. Also, we have what we call our Arkansas WIC program fact sheet. And in the back, it's translated in Spanish. We also have it available in Marshallese as well. So this would be helpful if you want to actually dig a little deeper and find out, okay, where's the closest WIC clinic to me? They're located in health department clinics around the state. We also have an app called My WIC app, and that's helpful to use. You can also find out grocery stores that are close to you, as well as the clinic information. And we have all of our nutrition education modules located there. So that might save you a trip to the clinic if you preferred to do some of your nutrition education in that manner. The other way that you can get more information about WIC than just the brief overview I'm giving you on this recording is that you can go to our website, which is healthy.arkansas.gov. You can also access all of our income guidelines to check that way if you're eligible without even calling. So why is it important for you to consider participating in WIC? We think of it sometimes being more about the food benefits, but there's so much more. There's so many health benefits that come from participating in the WIC program. We refer to a lot of health services that your family might need or be interested in. In addition, we make sure that you're getting all the services that we can provide in the health department clinic. Free shots for your infant when you're there for the WIC clinic. There is no charge for WIC services at any time. So if you're there for a WIC visit, immunizations are free if you get them during that visit. And also we provide things like breast pumps for women who have like a baby in the NICU, or she's separated for a period of time, or if mom is going back to work. We have a team of registered dietitians or nutritionists who can work with our families on proper weight gain during pregnancy and high iron foods. A lot of different entities and a lot of different states have discovered and done some research or some studying about how WIC has benefited participants who received our service up against those who were in a similar life circumstance but did not participate in WIC for whatever reason. And what we usually see is that our pregnant women have a better weight gain, which is appropriate for her pre-pregnant weight. Prevents her from having gestational diabetes during the pregnancy and later on in life. We see that babies are born with a higher birth weight, which usually means they were not a premature birth, which can save very long, extensive stays in hospitals, for instance. In fact, in Arkansas a couple of years ago, our number of overweight and obese children, actually we saw a decrease in our children that were participating in WIC. And related to infants and children, we see better growth, better development, less incidence of overweight and obesity, less rates later on in life with diabetes, particularly if the mom breastfeeds. Speaking of breastfeeding, we also have a 1-800 helpline that's available to you. So we have those support systems for you. And moms and dads and other caregivers, grandparents, whoever the caregiver might be, sometimes might find themselves with some children who have specialized needs, whether it be a premature baby that requires a particular formula to supplement breastfeeding or for a particular health concern. We can help with that as well. Just work with your provider on getting a prescription, and our WIC staff in the clinics can help you to get everything you might need from your doctor or other provider to help with those needs. We're here to help eligible families to be healthier Arkansans by helping our families with those nutrients that sometimes are the most lacking in young families, like calcium, protein, and iron. And that's why we direct our WIC families towards a specialized list of food categories and certain brands within those categories. We do have some culturally appropriate foods, and more will be coming in the future. I hope that when you go to the grocery store or you go around town and you may see some of our signs that say breastfeeding is welcome here by the Arkansas WIC program. I hope that that will stick with you and will remind you that WIC is here to help you and your family be healthy, and we can serve everyone. So like our logo says, think healthy, think WIC. And that's what I want to leave you with, in addition to a little slogan that the National WIC Association put on a video a few years ago, and I've always loved it. Your family has you, and you have WIC. So please come on in. We want to serve you and your family.
Turn it over to Gwen, and she's going to talk with y'all about nutrition and health and pregnancy and young kids.
All right. So my name is Gwen White. I am a general pediatrician that works here in Central Arkansas, and I'm very excited to chat with you all a little bit about a topic that I am very passionate about, and that is just healthy living, in particular looking at healthy living during pregnancy and immediately after pregnancy. So first things first, you're pregnant, now what? A lot of times this is one of those things that brings excitement, but it can also bring a little bit of angst and fear, because you're like, okay, what do I do now? Where do I go from here? So the first things first, you should always be taking a prenatal vitamin that includes folic acid. And that is, if you think that you're pregnant, if you might be pregnant, if you're trying to get pregnant, go ahead and preemptively start to do that. That will help to ensure that your baby doesn't have any what we call neurotube defects. So making sure that the spinal cord grows properly, and also make sure that you get those extra nutrients that you need to make sure that your baby's able to develop appropriately. From there, you need to make sure that you call your physician and set up your first visit. Prenatal care is so important, and having good prenatal care will directly correlates with having a longer pregnancy, which is what we want for it to happen. It also helps you to identify if there are issues early so that things can be done to help prevent problems. And so having those regular checkups are crucial. And then we recommend that you also go ahead and register for WIC. So registering for WIC is very important. WIC is a health program, and we'll hear more about it, but it helps to provide pregnancy care for women as well as children. So after the babies are born, it'll take care of those babies all the way up till 5 years of life. And so it's really important that you do that. And so good nutrition is so critical. It's so important. Making sure that you have good food, have enough food is critical for your growth and for your baby's growth. What we know is that the body takes care of you first. And so if you have a small amount of nutritious food, then the body will use all of that for you. But if you have ample amount of nutritious food, then that means that you'll be taken care of as well as your baby. And what we know is that good nutrition leads to good health for your children. But poor growth in babies leads to increased developmental delays. It leads to an increased risk of premature or early birth and a host of other problems. And so that is what we're trying to avoid. I also think it's important to point out that during pregnancy, health issues come up. People get what's called gestational diabetes, which is diabetes that happens just from being pregnant. They can get gestational hypertension or just blood pressure or high blood pressure just from being pregnant, and so many other problems. And so that is why having good prenatal care, going to your doctor's visits, going to your WIC appointments can be helpful, because again, if we can catch those problems early, we can help to prevent bigger issues from happening. Eating a healthy, nutritious diet will also help to treat those issues and to protect you. The other thing that I always like to point out at this moment is to make sure that if your healthcare provider says that you have diabetes or high blood pressure or whatever it may be, follow up with their recommendations, take the medicines, do what you need to do to take care of yourself. We know that people that have these issues end up can have problems long term, not only causing issues with your baby, but can all cause issues with you long term. And so making sure that you are, again, responding appropriately and doing as your healthcare providers recommend is really important. Finally, children that maintain healthy diets do better in school. So we know that the long-term outcomes from kids start when they are inside of you. So if they have good nutrition when they're inside of you, then that means that they can be born healthy and strong. And as they grow and develop, we know that continuing those good nutrition habits are very important. There are studies that show that kids that eat a good breakfast and a good lunch actually perform better in school and have better grades and get in less trouble in school. And so that is why it is so important to make sure that you are maintaining that healthy diet, both while you're pregnant, as well as once those babies are born. So just for a moment, I want to talk about what good weight gain is, because I know that we've all heard the phrase of, oh, well, you're eating for two now. And so we want to make sure that you get enough in. It kind of justifies all those extra snackings and cravings that we utilize. But it's really important to recognize that you don't need to gain too much weight. Now, these recommendations are for people that have just a single pregnancy or are pregnant with just a single child. So if you have twins or triplets or anything like that, these recommendations don't apply to you. But when you are pregnant with just one baby, during your first trimester or those first 13 weeks or so, you really don't need more calories. You should eat a regular, healthy, nutritious diet. During your second trimester, we encourage you to take about 340 extra calories per day. And then during the third trimester, about 500 extra calories per day. So the bulk of your weight gain, if you are a normal weight when you start your pregnancy, should happen in that second and third trimester. Now, if you are underweight at the beginning of your pregnancy, we actually recommend that you gain a little bit more weight, because if you don't have enough, if you don't gain enough weight, if you don't have good nutrition, then that's going to affect your baby's growth and development. Similarly, if you're overweight, we actually recommend that you gain a little bit less because to help avoid some of those complications that I mentioned earlier, diabetes and high blood pressure and that type of thing. All of these recommendations are very important to keep you healthy and to keep your baby healthy. And so how do we do that? How do we gain weight appropriately? Well, the first things first is to try to eat good, nutritious foods. So we recommend high fiber foods, foods that have whole wheats, popcorn and oats. We'll recommend lots of fruits and vegetables, those good fiber foods, and then recommend protein. So meats, eggs, vegetables. With the meat, I think it's very important to recognize that you don't want anything undercooked. You don't want anything raw. So those of us sushi lovers out there, you have to put that off for 9 months until you are done with pregnancy. If you like your steaks rare or medium rare, you're gonna have to dial that up a notch and try to move over to well done during your pregnancy. That's just to help avoid infection. We want to make sure that you have plenty of healthy fats, and then try to make sure that you have plenty of dairy and calcium fortified non-dairy alternatives if you are someone like me that cannot eat a lot of or tolerate a lot of milk products. As I mentioned earlier, it's important to avoid certain things. So raw, unpasteurized milk. Fresh milk is important, but you don't want it to be too fresh. So the pasteurization process helps to protect against infection. And so we want to make sure that you are using pasteurized milk and pasteurized cheeses. Again, raw meat or undercooked meat, uncooked fish and seafood can all be dangerous for you, and raw eggs as well. These are tips for food safety, not just when you're pregnant, but really all the time. You want to make sure that you're washing your hands thoroughly and washing all of your utensils thoroughly. Make sure you're cooking your meat all the way through, and then make sure that you're washing all of your uncooked vegetables, your salad, your fruit, all of those things. Because again, infections in moms can be very dangerous to both mom and baby. And so we want to make sure that we are protecting as much as possible. Other things that we want to avoid: alcohol. There are some studies that show that having a small amount of alcohol can be safe. But ultimately, what we want to do is protect that baby, which is avoiding alcohol altogether when you're pregnant. Similarly, we want to avoid smoking. That's tobacco, that's marijuana. We're finding a lot more moms are using marijuana to help with nausea and help with vomiting, but the long-term effects of that on the baby have been found to be detrimental. So we really avoid tobacco products. We really want to avoid marijuana. Caffeine is something that a lot of times we don't think about, but is something that's also very important. That can affect the baby's heart rate. It can affect the baby's growth. And so making sure that we're limiting our caffeine to less than 200 milligrams a day is important. And then, of course, any type of drug use during pregnancy can be dangerous to the baby, as well as to you. And so we want to avoid that. And so what happens once that baby is born? First things first, after you've had a safe and healthy delivery, we want to make sure that you are practicing safe sleep. And that is making sure that we're using the ABC. So your baby should be sleeping alone. So in their own crib or bassinets, always on their back, never on their bellies. We want to make sure that they are in a crib that is on a safe, firm mattress. So making sure that there are no stuffed animals, blankets, cutesy little passies that have all those little stuffed animals on them. We want to avoid all of those things, because all of those things can lead to sudden unexplained infant death syndrome, what is formerly known as SIDS. And that is one of the leading causes of infant mortality in our state, in our nation. And so we want to protect our children from that. We want to make sure that you sign your kiddo up for insurance and WIC and make sure that they're getting the healthy, nutritious products that they need. Visit your pediatrician regularly. What we have found is that kids that go to the pediatrician on a regular basis actually do better in school, actually have better health outcomes and better nutrition long-term. And making sure that you're getting your kiddos immunizations on time. And why does this all matter? It's because we are trying to prevent and reduce infant mortality and maternal mortality. Well, what does that mean? Infant mortality is the rate of children that die before reaching their first birthday. Now, that's something that is hard to think about and really hard to grasp, but it's something that happens on almost a daily basis here in the state of Arkansas. In the year 2020, we had 260 infants that died before reaching their first birthday. That puts us, if you look at it at a population level, that puts us at, for every 1,000 babies that are born, more than 7 passed away, which is horrible and really tragic and sad. From 2010 to 2020, the infant mortality rate in Arkansas actually increased by almost 3%. Now, over the last 2 years, it has actually decreased, which we are super excited about, but we're still ranked at number 46 in the nation, which is not where we need to be. We need to work on this. When we look at the breakdown of these infant deaths, about 63% of them actually occur in the neonatal period, which is in the first 27 days of life. The other 37% usually happen after that. The leading causes of infant death are, number one, prematurity and low birth weight. And then number two, sudden unexplained infant death syndrome. And so one of the big reasons why we're talking about this today, having this conversation about healthy living and pregnancy and what we can do, is because if we can keep that baby inside of you, if we can mitigate those outcomes, so if we can look at preventing the diabetes and preventing or taking care of those blood pressure issues, if we can get us to having good nutritious diets, then we can avoid the prematurity, we can avoid the low birth weight, and oftentimes we can avoid our infant death. When we look at our perinatal mortality, so those are the rates of babies that are born at 28 weeks of later, that are either stillborn or die immediately after birth. That rate was nearly 7 per 1,000 births. So again, very high in Arkansas. And when we look at the breakdown by race and ethnicity, it's astounding that Black infants are almost twice as likely to die as white infants during their first year of life. And those statistics should be alarming to all of us, because genetically we are all the same, whether we are white, Black, Latino, Asian, whatever it may be, we are 99% identical. And so the difference in these rates don't come from anything that is genetic. It comes from these preventable things that we can do. And so it is our responsibility to make sure that we are taking care of ourselves appropriately. It's our responsibility to making sure that we are utilizing those safe sleep habits, those ABCs that I mentioned on the previous slide, to make sure that we are addressing this. And finally, when we look at maternal mortality, so Arkansas averages 40 maternal deaths per 100,000 births. That rates us 50 out of 50 states. That is, we're literally as bad as it gets. We are the riskiest place to have a baby right now. And the reason for this is multifold. Some of it is lack of access. So we've had lots of hospitals that have closed around the state. The other big reason is that we have a high incidence of diabetes, high blood pressure, obesity, and those rates are going higher and higher. So again, good nutrition, making sure that we are taking care of ourselves appropriately and listening to those recommendations literally save lives. These statistics, again, Black women die at twice the rate as white women. And if you look at women that are older, so women that are older than 35, the mortality rate is 4 to 5 times higher than those of younger women. The toughest statistic that I see in all of this, though, is that 3 in 5 of these pregnancy-related deaths are preventable. What that means is that 40% of the time, there's nothing that we can do. It's a horrible tragedy that can't be prevented. But 60% of the time, more than half of the time, we can intervene. We can do something. And so that's what we have to do. And so hopefully by having this webinar and by continuing to do our outreach projects, we can work together to help reduce our maternal mortality rates, infant mortality rates, and have healthy and better living for us all.
I'm going to talk about the WIC basics. I've been studying WIC in Arkansas since 2021, and I have gone around, met with offices and people who work for the WIC office. I've met with the state agency and the head of the state agency. I have talked to individual participants from all over the state, and we've even surveyed people from all of the counties in Arkansas about WIC and what it's like to be a participant, in particular what it was like during the pandemic, because we lost 21% of the participation decreased during the first year from February 2020 to February 2021. Arkansas had the highest decrease in the country. And really what it is that people don't know about the program and they lack understanding of what the program really is. So what is WIC? It's the shorthand for a really long name, which is the Special Supplemental Nutrition Program for women, infants, and children. And that's where we get WIC from. It provides federal grants to states, and states administer the WIC program. What that means is your experience with WIC in Arkansas can be very different from your experience with WIC in another state. In Arkansas, we're one of 5 states that have an offline system, and that means that the way that participants receive their benefits is that they are encoded on a chip on a debit card as opposed to being in the cloud. So you have to go in and load your card every few months. Otherwise, you won't be able to receive your benefits. What WIC does really is it's a nutrition program. So a lot of times people have a confusion between SNAP and WIC. SNAP is from the Department of Human Services, and WIC is within the Department of Health because it was created as a health program. And it's for women who are pregnant, postpartum, and babies, and then children until their fifth birthday. One of the things that they found in the late 60s, early 70s, when they began the war on poverty, was that women and babies were especially at risk for low nutrition. And what that meant was malnutrition was growing at such a rate that we had catastrophic numbers of infants who died from insufficient food, and hospitals around the country just did not know what to do. And so in 1972, they piloted the WIC program as a program directed towards pregnant women and children to try to address that need. And very, very fast, they saw how good this program was, because I've never seen a pilot go from, a pilot in 1972, and 3 years later, they have established the program in law. So WIC is a proven program that really does what it says it's going to do. It provides the support and the nutrition to help people, and it does it in a way that is meant to ensure that pregnant moms, postpartum moms, babies, and kids up to age 5 are healthy, have the nutrition that they need. And then, in 1978, they introduced legislation that included adding things like nutrition education, targeted nutrients, which we'll talk about a little bit later with the food packages. And then also, coordinating with other programs and services. They provide referrals. They also do vaccinations in the clinics, because in Arkansas, all of the WIC clinics, except for 2, there are 2 standalone clinics in the state. Except for those 2, all of the WIC clinics are in your county Department of Health office. So why is WIC important? There have been numerous studies. Gwen talked about some of this, but it reduces premature births. Premature birth is one of the highest risks for infant mortality when we look at those numbers. And it's also a risk for the mother. So we think about it often, the baby is born premature, the baby needs more assistance, but it is also a risk for the mom. It reduces low and very low birth weight babies, because if you're going to WIC, you're getting referred right away to medical care. Some places in our state do not have OBGYN within 50 miles of the county office. And in that case, the WIC office provides OBGYN services for pregnant women during that time. And so if it wasn't for that service, these very low income women would not have any access to a doctor in reality. Again, it reduces fetal and infant deaths. It reduces the incidence of low iron and anemia because they target the food packages to the individual. It increases access to prenatal care, as I said. It increases pregnant women's consumption of key nutrients that are important to the woman and the growing baby. It increases immunization rates, which is very important. Improves diet quality, and increases access to regular health care. So what does WIC provide? It provides supplemental food in a package. So the way that WIC works is very different than the way SNAP works. SNAP works, you receive an amount of benefits depending on the number of people who are qualified in your home. Those benefits are automatically loaded on your card at the 1st of the month or the 15th or whatever it is, but they're automatically loaded. You go to the store and you spend your benefits, and you can carry them over. So if you get $185 and you only spent $180, those $5 will still be on your card next month, right? WIC, you have to spend all of your benefits in the month that they're given, because the food package is meant for the nutrition during that month, and it's meant for each individual person. They also provide nutritional education to help improve diet and health habits. That comes in the form of classes, but they also have things like cookbooks about WIC food products and what kinds of meals you can make, which is really great, because I think a lot of people, especially young moms, may not be familiar with like cooking an actual whole meal from something, from the way that WIC is set up, and it can really help you and give you ideas. And I know TikTok is not a good thing for the state government and the federal government, but there are a lot of people on TikTok who do this, who are on WIC and show like, hey, I made this meal. This is what came from WIC, and these seasonings are not from WIC. So I spent like $3.83, and this is what I made. And that's really helpful for people, but it's also really great to see people showing how WIC benefits them and how helpful it is to them. Also, the nutrition information is available on the app. My WIC is the app, and in there the classes are available, but they also have nurses on staff in each WIC clinic. And so if you have questions or concerns, or you need information about, you know, nutrients or how to prepare things, the nurses are there to help you. There are also what they call FACSIs, family and consumer services people. They are there to help identify like what issues you're having and how can they help refer you or give you resources. So if you're not sure how to cook something, or you're not sure what, you know, what would go good with this, they're able to help you with all of that. One of the things that I forgot to mention about the food packages is that there's also what they call the CVB. It is fresh fruit and vegetable benefit. Right now, that amount is like $44 for a pregnant woman. Each individual person, it's a different amount, but that increased during COVID. Before, it was $11. And if right now there's a funding crisis with WIC, so you know, there's a potential that we might lose that higher benefit, and that would be a real hardship with the increased prices that we see in the grocery store. When you think about it, if it's going to go back down to $11, what can you reasonably buy from fresh vegetables and fruit for $11 that's going to last for the whole month? Or could you dole out $11 on fresh vegetables and fruit over a week at a time? It's not going to happen, right? So the other thing that WIC supports is breastfeeding. Breastfeeding is really important, and it provides a lot of nutrients to the child. It helps ensure that they are healthy, their immunization system inside is better. And we know that breastfeeding is great. But if you can't breastfeed, or you choose not to breastfeed, they also provide formula. And for kids that are born and maybe born early or have some kind of issue and they're in the NICU and they need specialized formula, they can get a prescription, and they can get prescription formulas. You know, regular formulas like $40 a can now, I think. Prescription formulas are very, very expensive. And so being able to have access to that is really important for those families that have children that have these special needs. I spoke to a mom who her child was born with failure to thrive. And even though the child is 2, they still are underweight. They've been working on it this whole time since they were born. And so through WIC, they get Boost, and Boost is really expensive. It's a nutritional supplement, you know, it's a drink, but it is very expensive. And so to be able to get that assistance for her is just incredibly important, because 1, her child needs it, but 2, she would not be able to pay for what her child needs on her own without WIC's assistance. There are
Hey, Marcel, we have a question.
Sure.
Do WIC participants have to purchase all the items within their package, or can they pick and choose?
They can pick and choose. So you can go to the store once a week, you can go 1 time a month, you can go twice a month. It's very different. So people who know the old WIC program, when you had the coupons, all of the milk was on 1 coupon, right? Now it's on a debit card. So it takes off what you purchase at that moment. Whatever you have left is still on the card. But when you used to have the yellow coupons, you know, the big giant WIC checks, you know, you had to buy all of the gallons of milk at one time, which when you think about it is kind of ridiculous. Milk doesn't last for 4 weeks, right? So this is much better to allow families that flexibility that they need to be able to buy what they want and what they need at that time. Also, because of what happened in COVID, a lot of flexibility was granted to the states, and some of that flexibility is still in place. So before, for example, if you're pregnant, you can buy beans or peanut butter. Okay. But because we had all of those problems with, things not being available in the grocery store, if you chose beans, you wouldn't be able to change it at the store. They were able to switch that under these flexibility rules that they were granted, and that's still available. So now if you have 2 alternatives or 3 alternatives, whatever it may be, you're able to switch it in the store without ever having to have a problem and having to go back and say, I couldn't get this. Can you switch this for me? This is really important because there is a high tax of time on poor people. And when you think about that, they have to go to the office to get their card loaded every few months. That is hardship. For many people, that I spoke to, they only have one car, so they can only go on a certain day of the week grocery shopping. That means they have to get their benefits loaded before that. A lot of people had to get assistance, get somebody to take them to the office. And then if you can't go to the grocery store and get everything you need when you need it, that is likely that they're not going to be able to use all the benefits. So this is a really great thing that happened. The flexibility that's been given to participants to be able to choose what they need. So there's nurses, and this is really important in Arkansas because we did not take up, so Arkansas Advocates has been advocating for many years the expansion of Medicaid for pregnant women up to 1 year postpartum, and for infants automatically 1 year as well. We did not take up those bills this session. In theory, there may be a special Medicaid session next year. We'll see. There was supposed to be one when they had the tax session and it didn't happen. But we support expanding Medicaid because we know that access to doctors in that first year where we have such high mortality rates for both the mom and the child is really critically important. But WIC is going to provide services to you for 6 months if you are not breastfeeding, and for up to a year if you're breastfeeding, even if you're partially breastfeeding. And that means that you have access to a nurse, which is medical care, and you're able to go in and talk about any issues that you're having. Medicaid now expires after the 6-week visit. So once you have your 6-week visit after the baby's born, your Medicaid automatically is expired. You have to reapply if you qualify on some other independent basis, but most people don't qualify. And that means that they will not receive Medicaid. They will not see the doctor past that 6 weeks. And that is why we have such a high infant and maternal mortality rate. So one of the main reasons is that people do not receive the medical care that they need. No one is seeing those people. No one is putting eyes on those people to say, hey, you don't look right. This is not, you've lost 20 pounds since I saw you last month. What's going on? And being able to access a nurse at your WIC appointment anytime you want to make an appointment is really important. Also, they monitor, the children's weight and growth. And I think that's really important when we think about the health of the baby. You really need to know how much, are they growing? How fast are they growing? Are they not growing? Have they regressed somehow? Did something happen this month different? Being able to track that is really helpful, but also being able to know the baby is being seen, hands are being put on your baby to make sure they're testing. Also, they do a prick test, fingertip prick test for blood, and they run a variety of tests for free. That would cost you a lot of money if you had to pay for them. But they're testing for things like anemia, diabetes, low iron, all kinds of things that can really impact that child during, that first year and in the first 4 years of their life. One of the most important things that I learned, which is not actually from WIC, right? But this is brain science. I'm not a doctor, I'm a lawyer. I don't like needles. That's why I'm a lawyer. But brain science is really important. And we know that by age 4, a child has developed 80% of their brain, 80% of what they're going to be. And our brain develops in stages. So you have to have those nutrients coming the entire time, because if you get malnourished or you have some unidentified illness that is not being treated, it really can impact how that child is developing, not just physically, but also they may have developmental delays that impact them going to school or needing extra services. They may need to apply for assistance through Medicaid for things like language assistance because they have a language delay or other things like that. So that's really important. Now, when you think about WIC and nutrition, one of the things that you can look at is online on their website, they have the nutrition manual in all different languages. So you can see they have English, Spanish, Marshallese, Dari, Arabic, Pashto, Swahili, Kinyarwanda, and French. These English and Spanish they had. These rest are brand new. They got them this year. Well, within the last year. They've really been working on being more accessible to Arkansans in many other languages. One of the things WIC has is they have access to a language line. So for people who speak a different language, no matter what it is, they have access to more than, I think, 100 languages or something like that through their language line. So anybody who wants to make an appointment can receive services. They do not have to bring their own interpreter, and they can have it. So if we look at the WIC approved list in English, it's kind of misleading that it says it's a list, because this is actually a book of all the things that are available through WIC. So the WIC program approved food list, you can see it's a booklet, right? It talks about how the WIC card works. It shows you like an example of the grocery card and what it's going to look, or grocery receipt and what it's going to look like. This is about the WIC app, and you can scan and download the app. And then it talks about what breastfeeding provides, what formulas provide, and then it shows you each person by age what they get in terms of food products, or at least it tells you, because there's a list of what's allowed and what's not allowed. And you see, okay, dairy, all of these things are allowed no matter who they are. You can get this type of thing, but depends on who it is, right? So here, soy-based beverage is only children 2 years and older, and women are allowed to have soy-based beverages. And that's because it's based on a nutritional package that is targeted towards the children and the women, each individual. Okay, so here is a better example of how to look at these food packages, especially if you're going to use this to talk to people who may be eligible for WIC. Because when you look at that other one, there's a lot of writing. But for participants in particular, this is much easier for them to understand when you're seeing how much stuff it is, right? So for a pregnant woman, you're getting 4.5 to 5 gallons of milk, 1 pound of cheese, a dozen eggs, 36 ounces of cereal, peanut butter, 4 cans of beans or 1 pound of dry beans, whole wheat bread or tortillas they have now. They have also expanded in Arkansas more cultural type foods. They're working on expanding more of those as well. So you'll see that now. So this was pregnant women. Here we have non-breastfeeding postpartum women. So you see it goes from 4.5 to 5 to 3.5 gallons of milk, because it's less.
And can you say what postpartum means?
Oh yeah, sure. So postpartum means when you've had the baby. So postpartum is in the year immediately after you've had the baby. So for WIC, if you're postpartum, if you're breastfeeding, you will be eligible for 12 months. If you're not breastfeeding, then you'll be eligible for 6 months. So postpartum means after you've had the baby. So you will get services as a pregnant woman. You will not have to reapply for yourself. But like Gwen said, you need to apply for the baby because the baby's now born. So they need to be put on the WIC, right? But your other children who qualify, say you have a 2-year-old and a 3-year-old, they can already be on WIC when you apply. So when you look at this, when participants look at this, they find this much easier to understand how the program works, because this is a lot different from SNAP, right? This is specific food products. It is not an amount of money except for the fruit and vegetable benefit. So now here's infants. So partially breastfeeding 0 through 11 months, And then 9 through 11 months, again, alternate packages depending on where they are in their journey. Here we have fully formula feeding, 0 to 11, and the same thing, alternate packages, and then children 1 through 4. So one thing to remember is that these food packages are supplemental. That means you can have SNAP and you can have WIC. You do not have to give up one or the other, because both of them are the special supplemental program for whatever it is. Looking at these images is a lot easier for participants to really understand what it is they're going to receive. So who is eligible? Okay, I do not put these in a paragraph on purpose or even in bullet points. They're in their own little box, because a lot of times people think they are not eligible unless there's a mom that's eligible. And that is not true. So pregnant women are individually eligible. Postpartum, women who just had a baby, women who had a miscarriage, or even an abortion are eligible for up to that 6-month period. Postpartum women who are breastfeeding, that's up to 1 year, infants, and then children up to age 5 to their 5th birthday. So when we talk about this, let's say you have a 2-year-old and a 1-year-old. You are not pregnant. Are your kids eligible for WIC? It depends on the income level that you have, but they meet the age requirement. They're going to be eligible for WIC. Independent of you, you don't have to be eligible at all. They do not need an adult caregiver to be eligible to give them for them to receive the services. So that's really important. Okay. You have to think of these as individual buckets. Each person on this list is independently eligible. So the infant can be eligible. And this is a question I get a lot. Well, what if I lost all of my documents and I don't have any ID or any proof of who I am? Your husband can go and your husband has documents. Your husband can go and sign up the kids for WIC while you're getting your stuff, and then you can sign up, right? But also WIC will work with you on what is proof of who you are. So you don't have to have a state ID or a picture ID even. They prefer it because they want to be sure, but they will work with you. Things like a letter addressed to you, also medical bills or medical records count for identification. But if you currently do not have what you need, that doesn't mean that the kids aren't going to be independently eligible, and you can sign them up right now. While you're waiting to get whatever you need, you can still sign them up, right? And that's important because it means that you'll be getting benefits for those kids right now instead of waiting for all of you to get it at one time. It's not necessary. The other thing is I interviewed a dad who did not know that he could go and apply even though his wife had passed away. So he thought because it was women, infants, and children, he could not apply at all, even though he had a new baby and 2 other kids who were under the age of 5. He completely has 3 kids who were independently eligible and was able to apply, but it took someone telling him about the program that he knew to be able to go into the office, because the name of it convinced him that it meant that they had to all be together. They do not all have to be together. They can be all separate. The other thing is you do not have to have legal custody of the child. We have an opioid crisis in the United States. I think that's very well known. We were hit very hard in Arkansas as well. We have a lot of families who have the grandparents have physical custody of the child, but not legal custody of the child while the parent is serving time maybe or is in rehab. They can apply on behalf of the children. Or if the kids are living with an aunt and uncle, whoever has physical custody of that child, they live in their house as long as they meet the income guidelines, those kids are eligible on their own. You don't have to have the parent there. You don't have to have the parent's permission, and you don't have to have legal custody, which is often not going to happen in a case like that because they don't want to cause more problems for their children that are already in jail or having issues, right? They don't want to take the kids away from their child. That's not what they want. They want their child to get better and be able to come back and have their kids. So they're not going to go to court and generally take away custody if it's not required by DHS or something. So if you have physical custody of that child, you can apply.
Marcel, we have another question. Is it possible to receive reminder messages that it's time for people to reload their WIC card?
We do not have that capability yet. So they are working on some new technology. The money for WIC, like I said, comes from the federal government. It comes from the Department of Agriculture, and the division that oversees it is the Food and Nutrition Service. FNS, the Food and Nutrition Service, is right now looking, it's put out some memos this year, looking to increase flexibility and expand options, because there was a lot of concern in earlier days when we went to debit cards of, well, if we're sending text messages or whatever, like, how are we going to protect and encrypt that data? Or, how are we going to do that in a secure way? A lot of states have done it now, or are working on how to do it in a different way. And so now FNS has seen that during the pandemic, they gave waivers for a lot of things because we had to make do. And during that time, innovation ruled. And so now we're seeing that those things are becoming more accessible and more available. I know the state is looking into that type of thing, but basically, when we come out of this crisis of every 2 months having to pass a continuing resolution so we have a budget, usually you will have every 3 months you'll go load your WIC card. And how will you know that you have benefits or not and you need to go reload? It's on the bottom of your receipt how much you have left. So if you went in January, you got to go back in April, because at the end of March, you're not going to have any left on there, right? You will get a notice that you have to renew your certification. You will need to do that at every year. So that's an extension for us as well. It used to be every 6 months. We moved that to a year, and that's been really helpful as well for parents. So you will get a letter that you need to make an appointment to do the renewal, but basically all you're doing is proving the income requirements again, because they already have your identity and all of that. So the requirements to apply for WIC, you have to prove that you live in Arkansas. WIC calls this proof of residency. A lot of people who are immigrants get concerned about that because of federal rules against using benefits. WIC is a program in Arkansas in particular. We have not passed any modifying rules. So what that means is WIC does not require a social security number. It does not require you to be a U.S. citizen or a permanent resident. It does not require you to present a visa or proof of status. They will not ask that information. It is not required. It is for any person who is pregnant, postpartum, infants, and children up to age 5, no matter their status. So you could be on a temporary visa. It doesn't matter. They're not going to ask. You could be a refugee. Again, they're not going to ask. You could be a permanent resident. They're not going to ask. And WIC cannot be held against you later on when you're applying for benefits. It is a program designed to make sure that you are healthy during pregnancy, because your child is going to be a U.S. citizen when they're born, and we want them to be healthy when they're born as well. That is really what that's about. And that's why everyone is eligible, because we want to make sure that we're having kids who are not born with these preventable diseases that can carry on lifelong when you have malnutrition. So ignore when they call this proof of residency. If you're talking to people in the community, especially, you don't want to call it that because it gives them concern. And instead, it's just proof that you live in Arkansas. And why is that important? Is because you cannot use your WIC benefits out of the state that you live in. So if you live in Texas, you cannot use your Texas benefits in Arkansas. If you live in Arkansas, you cannot go to Oklahoma and use your WIC benefits. It's because the money is allocated to the state. Remember, they have a certain amount of money. That money is meant to be spent within the state. And so you have to use the benefits in the state that you live in. Proof that you live in Arkansas, again, it's like a letter with your name on it, or, your rental agreement or whatever. You have to have proof of your identity and the identity of any children you are applying for. What does that mean? Birth certificates. It can be an ID. It can be a consular ID. It can be a city ID. The city of Little Rock and the city of North Little Rock have municipal identification cards. Those are eligible to use. It can also be, like I said, medical records or other documents. They will work with you. A really important thing to note, if you only have 2 of the 3 of these, you still can apply for WIC right now, and they will give you 1 month of WIC benefits while you're getting the 3rd thing. So again, don't wait to collect all the things. If you have 2 of the 3, you can apply right now, even if the thing that you're missing is your identity. As long as you have 2 of the 3, you can apply right now. They will give you a temporary benefit for a month, and then you will have to in that time come up with proof of who you are, bring that to them, and then you'll get the benefit. If you are pregnant, you do not have to have proof that you went to the doctor and got a test at the doctor's office. You can come in on your own volition and tell them that you're pregnant. You took a pregnancy test at home. Again, it's because WIC wants you to get benefits as soon as possible. They are not trying to put these barriers in front of people to really restrict it and make it like you have to have access to a doctor. What if you cannot afford to pay for a doctor's visit just to have a pregnancy test when you've already taken one and you know you're pregnant, right? And then the 3rd thing is proof of your income or of no income. You have to be 185% of the poverty guidelines. So WIC is who is automatically eligible. That is people who are pregnant and on Medicaid, you're automatically eligible. You don't have to have proof of your income because you've already provided it to Medicaid. People who have children who have RKids A, automatically eligible. People who have SNAP, automatically eligible. Again, one of the things that Food and Nutrition Service oversees is they oversee SNAP as well as WIC, even though it's in 2 different divisions. In our state, Health and Human Services is all together in the federal level. So FNS oversees both of those programs. And what they're saying is, hey, if we already have provided documents to Medicaid showing that they meet this amount, we don't need to make them, do it again. Let's make it easier. Let's communicate between agencies, make it easy as possible for people to get the benefits that they're eligible for. And one of the things that's important here, right? So let's say you have 3 people household. So it's a single mom and 2 kids who are under 5. So all 3 of these people, the mom is pregnant, all 3 of these people are going to be eligible. The most that the mom can earn is $45,991 in a year, or $1,917 twice a month. So let's say that the mom earns $1,920. She is $3 over eligibility. What they are going to do, because she's pregnant, is they're going to count that household side as 4 because she's pregnant. And the infant is going to count because, again, the benefits that they're giving to the mom are intended to benefit the infant as well, who's not yet born. And so they'll kick you up to here, and now she's okay. She's not going to be kicked out for that $3 because now she has this extra $400 essentially that in income that can be used. So that's really important as well. If people are close to the income limit and they think they're over, go and check because you might not be.
Hey, Maricela, I have a couple questions.
Sure.
In terms of what counts as household size, if you don't have your own personal housing at the time and you're doubling up with, like, you're living with your friend and you and your kids are living in your friend's guest room or something like that, how does that impact household size?
Okay, so how it depends is, are you guys commingling your households, right? So are you guys putting all your money together to buy groceries? Are you putting your money together to pay the bills together? Or is, for example, one person paying everything and you're just living there and you're living off of your own money, right? So you make a little bit of money and you're buying your own groceries. You're not paying for all the stuff, this other person's paying for it. So the way that it will work is if you're co-mingling, then that person's income is going to count and their kids and their spouse is going to count in family size and the total income. So let's say there's 5 and there's 3, that's going to be 8 people total. And you're going to have to look at a total income right here. Okay. You got to be less than $93,536. But if you are living separately, that person can literally say, hey, I'm renting them a room. They pay for this room for them and their 2 kids. this is how much they pay. We don't share our finances, and they will accept that. And then you're back down to 3, or if you're pregnant, the 4. So that's how that works.
What if they're not charging you? What if you're not
Even
paying rent to your
if they're
friend?
not charging
Okay.
you, they just need to write a letter saying that. They're allowing you to sleep in their house because your cousins, your friends, whatever the reason, and you've been living there from however long. I don't charge them rent. They have 1 room, they have 2 rooms, whatever the case may be. And that's going to be fine. If you have no income, it's the same thing. You need a person who is not a family member to write to say that you have no income. So a friend can write it. If you have, for example, we saw this during COVID, a lot of family members ended up moving into multiple families in a house, right? And when that happened, a lot of times it was because one family member lost their job. So let's say the person who lost their job is pregnant, has kids, eligible for WIC, but they don't have any money because they lost their job. So they've moved in with their sister. Their sister has kids. So this sister is paying for everything, right? All you have to do is bring proof of the sister's income, that they are the ones supporting you. It'll count the household altogether. And based on wherever you fall as a together household, that will be sufficient. So it really depends on, are you guys putting your money together or not? If the person isn't working, if they're pregnant and they can't work for whatever reason, they have they're on bed rest or whatever, and they have no income, all that person has to do is write a letter saying they're living here, they have no income, they are staying in one of my rooms, and I provide everything for them. And then they're going to use that person's income. If they do have income and you're not charging them, then they buy their own stuff. I'm not charging them because she needs to get back on her feet. They just have to write a letter and then include their contact information so that the Department of Health can verify.
And what about in terms of people applying or keeping their WIC benefits? What if someone is living in temporary housing and moving around? Maybe they're at a hotel for a bit, maybe then they go stay with a friend, maybe they go back to a hotel. What do they do in that situation?
So every time you move, you're supposed to notify the Department of Health, because if they're sending you that renewal letter, it's going to go to the last address they have on file. Now, in that situation, what I would suggest to the person is that instead of changing addresses all the time, that you explain to them that you are couch surfing or you're homeless and you're just finding places as you can. And again, they're going to ask for a letter saying, okay, I've let them stay here for a week on my couch so far, right? And you're going to have to explain whatever the situation was. I was in a hotel, I can't afford it anymore, or they kicked me out because they had bookings and whatever. And now I'm staying on my friend's couch. And then after 2 weeks, I have to go to somewhere else. I don't have a place yet. What in that situation, what I would really recommend in terms of making sure that you're going to get the letters that you need from the Department of Health is to find someone who will allow you to use your address. And if you're here in Little Rock or in North Little Rock, Jericho Way is not a shelter. It's listed with the shelters, but it's a day center for homeless. And what that means is there's a lot of services that you can access at Jericho Way, including showers, including washers, wash and dry your clothes. They serve meals. But one of the most important things Jericho Way does for the community is they allow you to use their address. So you can have your address where you're living when you apply, and you can have Jericho Way will give you permission to use their address, and you can use that as where you need them to mail your documents to. Okay. So then, when you look at the income guidelines, what I always want you to think about is the mom pregnant? Because that bumps us up one size. If she's pregnant with twins, it's going to bump you up 2 sizes. So again, remember that flexibility and think about applying. Let them tell you you don't qualify, right? And then let them tell you the reason, because maybe the reason that they have is not right, and you can dispute that. So all of these 3 things that you have to prove, you do not have to apply. When I talk about apply, there's no application form for WIC. Okay, SNAP, I think is up to 30 some odd pages now. So there is no form. People ask me every time, can we print the forms? There is no form. What you have to do is call your local county office or any office actually in the state and make an appointment. And you're going to bring those 3 things. So what are they? They're proof of the income, proof of who you are, and proof of that you live in Arkansas, right? So the reasons that they say call your local county office is because that's going to probably be closest to you. But you really can call any office in the state. So let's say that this week you're in Little Rock because you're attending something and you have to be here all week. You don't have to wait till you go back to your house. If you have this stuff with you, you can apply right now. If you have 2 of the 3 things, remember, so you don't even have to wait to go back because you had left one of them at home. So let's say you don't have proof of your income, but you're pregnant, you have proof of who you are, and that proof of who you are also has your address. You have 2 of the 3 things. You have proof that you live in Arkansas, you have proof of who you are. You can apply right now. You will get that 1 month of benefits. This week that you're in Little Rock, it doesn't matter at all because the benefits you can use anywhere in Arkansas. So like that they're giving them to you in Little Rock doesn't matter. What matters is that you're going to go back home, let's say Ashley County, wherever, you're going to make an appointment at that office to bring that 3rd piece that you need, which is proof of income, right? So that's how that works. But you can go to any office that you want. Okay. Right now, in theory, well, let me step back. So in theory, you should get an appointment within 2 weeks for WIC. Right now, some of the offices are still struggling with low staff ratios and higher application rates. So for example, in the Northwest, they process like 1/3 of all applications of the state. So between 1/4 and 1/3. So they have a lot of people up there that are applying, and they also got very hit hard during COVID in terms of losing people because Central Arkansas has always had a low staffing problem. Northwest did not have that problem before COVID, but they lost a lot of people during COVID. So sometimes the office that might be closest to you is not going to have an appointment soon enough. So you can call to any county office, you can go to any county office. And on the WIC website, which is healthy.arkansas.gov, you can see, look, Calhoun is open from 7:30 to 5, Monday, Wednesday, Thursday, 8 to 4:30 on Fridays, 8:30 to 6 on Tuesdays. So you can pick not just based off of who has the better appointment time right now, but you can also pick which one has more time available. Like I can get an appointment at 5 o'clock. That's what I need. I'm gonna pick this one instead of, I don't know, this one's only available till 4:30 on Fridays, right? So you can choose what's best for you. Now it's hard for people. Again, county office is we're talking a big area when we're talking a county. In Little Rock, there are multiple clinics in the city of Little Rock, not just in Pulaski County. There are multiple clinics within the city. But when you get to some of the counties, you see there's only one, right? And that is hard. I mean, Benton is a pretty big county and there's only 2. When you want to make an appointment right away, you can shop around. Whichever office is fastest for you, or whichever office has the access at the time that you need on the day that you need, right? So if you need an appointment on a Friday because Friday afternoons you're off, whichever one has that available for you. You do not have to go to your home one, but once you get approved, that's where you're going to want to go because you don't want to drive out of your way to get your benefits reloaded. Does that make sense to everybody? You do not have to have a form filled out. They are going to enter your information. And when you call, they're going to pre-screen you. So they're going to tell you, like, they're going to ask about what documents you have, whether those are eligible or not. And they are going to make sure essentially that you have what you need for the appointment when you come in. One of the things that people talk about, WIC is invasive. And they say that in the way of they get all up in your business. That's what I hear most, right? It's because when you have that first appointment with the nurse, if you're pregnant or not, if it's for your children, there is a lot of questions they are going to ask. But these are targeted questions, right? These are intended to find out, do you have any risk factors for this pregnancy that are known, right? Do you have risk factors in your family? Do you have heart disease that runs in your family? Things like that. This is why it's really important for people to understand that this is a health program and a nutrition program. It's not a food program. They're asking you things because they want to be sure they get you referred for services if you need it. They also want to be sure they're tracking you to make sure that you don't develop something. One of the things that Gwen talked about was gestational diabetes. When I talked to a lot of very young moms, they did not know that you could get diabetes from being pregnant. They did not know that. And so one girl actually went to her WIC appointment, and that's how she found out. And her blood pressure was super high, and they sent her right to the ER. And she was at risk at that moment and did not know it because she just assumed she feels bad. She feels bad all the time. She's pregnant. This is what it is, right? And having that access to healthcare, even though it's not a doctor necessarily, they are trained to look at all these different things and say, hey, this is not right. Let's get you somewhere and get referred. That is the training. They are meant to refer you for whatever services that you need. And they also provide referrals to things like food pantries if you need that as well. Maybe there's that whole other family in the house too, right? So you're going to need more than just WIC. SNAP is more restrictive in terms of what they will accept for some things like identification.
And SNAP is EBT benefits, right?
SNAP is food stamps. It's the EBT card, but WIC is also on an EBT card. So that's why I don't call it EBT benefits. EBT is just the card. It's an electronic benefits transfer. That's what EBT stands for. So SNAP is essentially food stamps. It's just an amount of money that you get based on your family size, how many people are eligible. But for SNAP, if you are not a permanent resident with more than 5 years of status or a citizen or one of the exceptions, which would include refugees, human trafficking victims, victims of domestic violence who have a VAWA case approved, then you're not going to qualify for SNAP. Your kids who are U.S. citizens will, and we in Arkansas don't put extra money in to SNAP. So what that means is that the only persons who are going to get qualified for SNAP are the U.S. citizen kids. So you're going to get food for the 2 people, not 3 people. And that's different from WIC, right? We don't care about status in WIC. So you're going to get WIC and your kids will get WIC. And that's important. It doesn't mean don't apply for SNAP. It just means that it's another assistance for you. But WIC is a health program first and foremost. That's why you need to think about how do we talk about it when we're telling people, because it's not like going into SNAP where they're only looking at certain income. Basically, they're looking at, do you have money that they don't know about? That's the most thing SNAP is looking for 99% of the time. But in terms of WIC, what they're looking for is, do you have hidden health problems that might cause risks for you or that you could pass on to your child? So for example, my mom carries sickle cell trait. My stepdad carries sickle cell trait. My brother carried sickle cell trait. His son has sickle cell. My mother did not know she could have sickle cell trait. She had no idea. And then when my brother was born, he was tested. And that's when they found out that they both carried the trait. That is something that you get tested for at WIC, right? That is something the baby's going to be tested for, because sickle cell is a serious illness that has to be treated. That's something that they're going to look for and test for. They're going to look for gestational diabetes. They're going to look for hypertension, preeclampsia. If you come in and your legs are suddenly swollen, they're going to start asking questions, because again, it's a health program. They're going to get you your food benefits, but if you need to go to the doctor, that is where they're going to send you. So you want to think about it in that way. Again, no application form. So it's already easy. You just got to remember 3 things. Who are you? Do you live in Arkansas? And how much money do you make? Right? That's it. Do we got questions?
I have a question for Dr. Gwen. If people want to add some questions in the chat, you talked about how many moms are dying in Arkansas because of pregnancy-related causes. And I think that a lot of people who are pregnant feel like their doctors don't listen to them, or their doctors diminish their concerns and act like what they're concerned about isn't a big deal. How would you recommend people best communicate with their doctor about concerns they have about their pregnancy? And then what should they do if they've tried and they just feel like their doctor's not listening to them and they're worried?
Those are very, very good questions. And what I tell every person that I interact with, every mother that I interact with, is it's your job to be an advocate for yourself. And so if the physician or if the practitioner has not given you peace of mind, then ask again and continue to ask and ask and ask. What I always try to do with my patients is ask them, what are you most concerned about? And at the end of our conversation, if you're still concerned, then we need to regroup again and restart the conversation. And then, there are situations where sometimes the provider that you have may not be a good fit for you. And so if after you've tried to ask and advocate for yourself, you feel like you're not being heard, then I recommend just switching to a different provider or getting a second opinion. As a physician, I always say it's okay to have a second opinion because I'm not always right. I don't know everything. And so a second set of eyes may see something differently than I see. And so sometimes that is necessary. And it's not something that we should feel bad about or feel guilty about. Advocate for yourself is the most important thing that you can do.
So I agree 100% with everything Gwen said, but I'm going to add one thing because I'm a lawyer. And what I'm going to say is, if you truly believe you have a thing, because doctors, some of them, especially older doctors, really hate the advent of Google or the internet, right? Because what happened is, like in early days of internet, you would put in something and it would tell you had 500 different really rare diseases, and then all of a sudden you and your doctor is saying there's no way this is possible, you don't have this like really specific thing, right? So they hold on to that prejudice, whereas we know now as patients we do have to advocate for ourselves regardless of what education level you have, what income level you're at. You have to advocate for yourself, you have to advocate for your kids. You want to make sure they're getting the treatment. If they're not getting the treatment that you want, or you feel that the treatment is wrong, you are entitled, as a parent, to reject that and to say, no, I want another opinion. And so what I'm going to tell you is, if you say, for example, you 100% believe you have lupus, you have all the signs and symptoms of lupus. One of the most identifying signs of lupus is that you have a butterfly looking sort of mark that appears on the face, right? It's very, very prominent, and once you see it, you can't unsee it. So you 100% believe it, and your doctor says, no, I don't think you have that, it doesn't sound like it to me, and I'm not going to test for it because that's a waste of money, right? In that case, you're going to say, okay, I would like you to document in my records that I requested this and you refused me treatment. And at that moment, you might get a different response about the test, but I still would say I would go somewhere else after that. I would get the test right then if they're going to give it to you, but I would go somewhere else. You want it documented in the record that they refuse you treatment, because that's what that is. If you're saying you have this grave concern and there is literal tests that they can run to say yes or no, they are refusing you treatment. Because if the answer is yes, there's treatment that has to happen, right? So you want that documented in your record. And that is super hard because like we are ingrained with this idea that doctors have all this knowledge of every single thing. I think we have to be careful about deferring to people too much on the assumption that they know a lot more than you. You know what's going on in your body. Whether or not you know what that condition is called is a different story. But if you know that every single day you are having horrible acid reflux and you're pregnant, and it's so painful that you feel like you're having a heart attack, that requires more investigation into what is going on. Yes, it's true that you can get worse acid reflux during pregnancy because of changes in your body. but it could be something else. And women present differently for heart attack and stroke. So consider, right, that it will be very hard, but you're going to want to ask, document it in my record, because I'm going to take it somewhere else and ask for a second opinion. And I guarantee you 99% of the time, they will suddenly be interested in giving you that test that you asked for.
Dr. Gwen, as Maricela said, people are going to look up on the internet about health concerns that they have. And I know for babies, the CDC, the Centers for Disease Control, have a website about developmental milestones, and you can track how your baby's doing over time. And then if they're not meeting those milestones, you can have a conversation with your doctor about that. Is there something like a similar trusted resource for pregnant women?
That's a very good question. So the CDC does have some advice and whatnot for pregnant women as well. The other website that I think about frequently is healthychildren.org, which is targeted more for pediatrics, but also will kind of give you those milestones on what you're supposed to be doing kind of at different stages of your pregnancy.
And we'll get that website and share that out with y'all. After this, we'll put it, we'll send an email to people who registered, and then we'll put it in the comments of the Facebook live recording on Facebook. Maricela, can you talk a little bit about the WIC Farmers Market Nutrition Program?
So the Farmers Market Nutrition Program is a supplemental part of WIC that adds additional benefit to help families that may not have that access to really fresh fruits and vegetables in their grocery stores. We know a lot of places in Arkansas don't have access. And one of the things you have to think about when you're on WIC is it better for me to go to the closest store? Is it better for me to drive further because this store has more items? Because remember that the store only has to carry a certain percentage of WIC items. It does not have to carry 100%. And so the idea of the WIC Farmers Market really grew out of the idea of this fresh fruit and vegetable benefit that we really want people in places like Arkansas, where we have farmers markets all the time, all over the state, that are really, really fresh foods, to be able to spend those benefits in places like that. And so you have to check, and on that same website where we went and looked at the nutrition, which is healthy.arkansas.gov, they also have a list of authorized vendors for the farmers markets, and you can see if your farmers market has been authorized or not. That process is between like whoever runs it and WIC, but primarily you're going to be purchasing fresh fruits and vegetables from the farmers market. So that's the benefits you're going to be using, but it is an additional benefit that they add on. So it's a really good option for people who live in rural parts of Arkansas, where we know there's a lot of farmers markets. Even here in Little Rock, we have a farmers market, you know? So it's an option for you to get the freshest fruit and vegetables you can. One of the things you really want to be careful of, though, is making sure you wash all of that stuff, because again, in pregnancy, the chemicals or other things can really cause problems for you. So that benefit is available to everyone, and it's just an extension of that fruit and vegetable benefit, essentially. WIC just came out with a national report. The 2016 to 2020 enrollment and participation numbers came out. Nationally, somewhere around 52 to 56% of people that are eligible participate in WIC, which shows that the problem that we have is a national problem, but we are at 38% or 39%. So we are much lower even than the national average. We need to educate people about WIC, why it is important, why it's useful, and why they should go and use it. I want to thank everybody who was here, who participated. I definitely want to thank Gwen for taking her time out to talk with us tonight, because her information was so great. And thank you all. And again, Rebecca will be sending you an email with all of that information.